So exactly how deadly is America's opioid epidemic? We've talked about this at length, and according to this jaw-dropping new report, listen, it has claimed more lives in 12 months than all 19 years of the Vietnam War. Now, President Trump is now promising that will end now. So how does his administration plan to change that? Joining us to weigh in is Dr. Nicole Saphier. Thank you very much for joining us, as always.
Good morning, Heather. Thanks for having me.
You think that we need to tackle this with a multifaceted approach?
Absolutely. What's going on with Representative Moreno right now, I don't want that to be such a diversion. I don't want people to focus on, oh, we have to change this bill and that's going to solve the problems, because the truth is that's just a very small piece of the whole puzzle here.
Right.
It involves, as you said, a multifaceted approach from the...
So you would begin with, like, the pharmaceutical companies, I think you said.
Pharmaceutical companies, right now, they're able to do direct consumer marketing, meaning that's why you see their ads on TV. They're able to lobby to Congress and Senate. They spent over $100 million in lobbying alone. We need to stop that. We need to make sure that that stays legal. And really, it needs to be a relationship between a physician and a patient. We don't really need the marketing from the pharmaceutical companies. Now, when it comes to physicians, is there some nefarious prescribing going on? Absolutely. The far majority is not. The far majority are legitimate uses of opioids. But we really need a centralized system, because sometimes you have patients going to multiple physicians getting multiple prescriptions.
Doctor shopping.
Yes, exactly.
Something like that.
They don't even realize that certain medications are opiates because they have all these different brand names. So by having a centralized prescribing unit, we can monitor what patients are using. And we also should have strong guidelines on how to treat pain. We need to make sure physicians really know and are adequately educated how to treat it. That's why we have addiction and pain specialists.
Yeah. So when you talk about like a centralized system to be able to track more of it, that would also allow pharmacies to do a better job as well.
Yes, and this has already been implemented a little bit. Pharmacies are starting to take action, saying we're not going to say to a doctor that they can't prescribe, but maybe we're only going to give patients about 10 pills at a time.
Yes.
That way they're able to monitor how much and how quickly it's being used.
And that's already taken effect, right? Because you and I talked about that.
Yes, it is.
And then law enforcement.
We need law enforcement, and I would love to say that it's just a physician pharmacy problem, but really we have a lot of illegal substances coming in, and that's what people are dying from. These opioids that are laced with the more stronger opiates, like fentanyl. So from the southwest border, we have to stop the foot traffic, but also it's coming from overseas. China is actually manufacturing tons of these, and they're coming through our U.S. Postal Service.
Yeah, and coming through our Postal Service, and let's take a look at this specifically, the 5 states with the highest rates of drug overdose in 2015, and those are West Virginia, New Hampshire, Kentucky, Ohio, and Rhode Island. I know we've talked a lot about West Virginia specifically and Ohio.
Yes, so absolutely, and they're going to have to really focus on their statewide law enforcement. Although it's a national issue, this really is America's crisis, not necessarily these 5 states. Those states are going to have to devise some individual parameters for them specifically and figure out what's going on there and how they can fix it.
I mean, the numbers are staggering, and that really put it in perspective, the number that we talked about at the top.
The Vietnam War.
Yeah, the Vietnam War. That really puts it in perspective for people.
Another way of thinking of it is it's a September 11th attack every 3 weeks. That's the amount of casualties we're having from the opioid crisis.
Unreal. All right. Thank you, Dr. Saphier. We appreciate you coming in so early, as always.